Hello people, today I have learned something very new and I am here to share with you too the cases of viral encephalitis which was followed by dengue fever. So let me take you towards the journey of this very interesting and amazing case. There was 39-year-old male who has came to ER with the chief complaint of pain in abdomen, fever and headache since 3 days. There was no history of any bleeding manifestations such as melena, epistaxis or hematochezia. To knowing of yours, epistaxis is bleeding from nose, hematochezia is fresh blood from the anus or in stools, melena is black terry stools that comes from, there's a bleeding which comes from your upper GI tract. And why we are ruling out this bleeding manifestation? Because in patient of dengue fever, BP can fall down leading patient to shock which can further lead to death. So on arrival, GCS score was normal, that was E4, V5, M6, that was 15 by 15, means eye was open spontaneously when he was asked to. Verbal response was normal, means it was oriented, and motor responses, he was obeying the commands. Next, there was no comorbidities like hypertension, your asthma, tuberculosis and thyroid. Further, there was no addiction of smoking and alcohol. Why we have asked this particular history? Because we were ruling out further LFT derangements, that is cirrhosis or NFLD or alcohol related liver disease. And he was getting proper management in medicine ward, but in medicine ward there was an episode of persistent vomiting to this patient. Further, headache was there, altered sensorium was there. Because of all this thing, the patient was shifted to ICU. On the second day, when he was in ICU, he was having an episode of seizure at morning 3:30 am for 1 minute. And when I saw the investigations of this patient, blood picture shows thrombocytopenia, that was 62,000 was his platelet counts. Renal function test shows increase in urea. LFT shows increase in bilirubin levels, increase in SGOT, SGPT levels. ABG shows metabolic acidosis. Electrolyte balance was completely imbalanced, means there was hyponatremia, hypokalemia, hypochloremia, hypocalcemia. Further, lipase level was normal, that was 88 unit per liter. Normal is 23 to 300. And when I saw further, dengue test was positive, NS1 antigen was positive, IgM, IgG was negative, malaria test was negative. And on ultrasound there was finding of mild splenomegaly and cholelithiasis. There was non-contrast CT scan which was done, in which there was cerebral edema which was found. There was infarct, and I will attach that CT scan finding with this video. In the right side of the brain you can see this, and in the left side of the brain these findings are there. On examination, vitals were normal. CNS examination was done. Patient was conscious but not oriented to time, place and person. Bilateral pupil was reactive. Power was 5 by 5. We do the power test according to MRC, muscle power scale, in which 0 is no contraction, 1 is flicker, 2 is active movement with gravity eliminated, 3 is active movement against gravity, 4 is active against gravity and resistance, and 5 is normal power. So power was normal, but the GCS score was not right. It was around E2, V2, M3, that means eye opening was to pressure. He was making sounds on verbal response and abnormal reflection on motor response. So GCS score was 7 by 15, which is severe according to glaucoma scale. When reflexes were checked, right knee shows hyperreflexia and left knee shows normal reflexes. So till now the diagnosis of this patient which was made was dengue fever, NS1 antigen positive with thrombocytopenia, with acute cerebral infarct, with seizures and viral encephalitis. So let me tell you with So let me share with you something about viral encephalitis. Viral encephalitis is inflammation of the brain parenchyma. The cause is the virus. It can be EBV, that is Epstein-Barr virus. It can be HSV, that is herpes simplex virus. There are two types in viral encephalitis, that is primary and secondary. Primary is the one which occurs when the virus directly infects the brain, and secondary occurs when the virus starts the infection somewhere else and then travels to brain. So clinical features in viral encephalitis is fever, headache, vomiting, stiffness of neck. अगर stiffness of neck अगर हमें मिल रहा है तो we compare it with the meningoencephalitis also, meningitis sorry, and then we combine the diagnosis known as meningoencephalitis. So stiffness of neck, lethargy, confusion, drowsiness, hallucinations, slower movements, coma, seizures, irritability, sensitivity to light, and unconsciousness. So these are the clinical features which is found in the patient of viral encephalitis. Further, what is the pathophysiology of viral encephalitis? जो microbial invasion है वो blood brain barrier को क्रॉस करता है, वहाँ पर वो ब्रेन के अंदर ही उस टिश्यू में ही वो मल्टीप्लाई करता है, फिर मल्टीप्लाई करने के बाद वहाँ पर वो नेक्रोसिस कर देता है, फिर एडीमा हो जाता है, एंड देन देयर इज डिटरेशन ऑफ द न्यूरोनल टिश्यू. अब हम इसका डायग्नोसिस कैसे बनाते हैं? लंबर पंचर में हमें ल्यूकोसाइटोसिस मिलेगा, प्रोटीन रेज्ड मिलेगा, ग्लूकोज नॉर्मल मिलेगा या फिर डिक्रीज मिलेगा. पीसीआर हम कर सकते हैं जिसमें हमें वायरस मिल सकता है, दैट इज HSV या फिर साइटोमेगालोवायरस. EEG जब करेंगे तो जो ब्रेन की वेव्स होंगी वो स्लो होंगी, दे विल बी स्लो ब्रेन कॉम्प्लेक्सेस इन encephalitis. MRI के थ्रू हम डिफ्रेंशिएट कर लेंगे बिटवीन द पोस्ट इन्फेक्शियस encephalitis या फिर एक्यूट वायरल encephalitis. ब्रेन टिश्यू का बायोप्सी कर सकते हैं जिससे हम इन्फेक्शियस ऑर्गेनिज्म का पता लगा सकते हैं. देन फर्दर मैनेजमेंट इस पेशेंट का कैसे करेंगे? मेडिकल मैनेजमेंट होगा वायरल encephalitis का, दैट विल बी एसाइक्लोविर इज द ड्रग ऑफ चॉइस, एंड एंटीपायरेटिक्स फीवर के लिए देंगे, डायरेटिक्स देंगे ताकि सेरेब्रल एडीमा ना हो, एंटी कन्वल्सेंट्स देंगे, एंड मेनली हम मॉनिटर करेंगे ICP को, दैट इज योर इंट्राक्रेनियल प्रेशर. एंड यू नो दैट कि इंट्राक्रेनियल प्रेशर को मेंटेन करने के लिए व्हाट वी डू इज we give Manitool. And this was very beautiful case. I have learned many things in this case because CNS examination हमें जब करने को मिलता है तो हम बहुत कुछ देख लेते हैं, बहुत कुछ सीख लेते हैं, बट जो वीडियो हम रिकॉर्ड कर कर आपको दिखाते हैं उसमें सिर्फ पॉजिटिव फाइंडिंग्स ही होती हैं, बिकॉज इट इज़ शॉर्ट वीडियो, इट इज़ क्रिस्प वीडियो जिसमें आपको हर एक पॉइंट पे एक किक मिले कि हाँ कुछ है, एंड दैट्स ऑल. लाइक फॉर एग्जाम्पल वी हैव डन क्लोनस का टेस्ट किया था, क्रेनियल नर्व्स का टेस्ट किया था, तो वो सब फाइंडिंग्स में से कुछ पॉजिटिव खास मिला नहीं तो वो आपको बताया नहीं, बट इट वॉज रियली इंटरेस्टिंग केस फॉर मी. आई enjoyed learning on this case. I shared this case with you. I hope you have also enjoyed with me. So Dr. Muskaan Bansal is signing off now.